BioPharmaDispatch here today with Stuart Knight, who leads Roche in Australia, and he's also on the board of Medicines Australia, I should add. But we are talking about the transformational change that the company has just announced. And so, Stuart, thank you for joining me today. And maybe you could give us a top-line description of the changes.
Yeah, so Paul, as you know, we spoke about a year ago, I think it was, and we were talking about the fact that Roche is going on an agile journey. And the next phase of really what we did and announced today was the fact that we've decided on the fact that we're going to fully rechange the structural design of our organization. In fact, we're no longer even going to call it a structure, we want to call it a system. And so what we wanted to do today was provide to the team the design principles and the concepts that will go into the new system design.
And tell me, what's driven the change? I mean, where does it come from? Is it a global change? Is it a local change? And why?
So it's a global change, and you might remember when we spoke a few years ago, it was really in response to the fact that we could see that the environment externally is changing, and we did some market research in March of last year, and we were seen as a fantastic company with great products. However, we were seen as a bit old-fashioned, a bit hierarchical, and in many ways our processes were the worst in the industry in Australia. And so we took that on board, but at a global level, we could see that if we were going to try and meet the future needs of healthcare and really try to add value, then something had to change. And in fact, what's really crystallized that thinking was in January, the Corporate Executive Committee of Roche, the very top of Roche, laid out some 10-year ambitions for our company. And they're pretty bold and they're pretty interesting. And what's really crystallized it for us is the thought that, you know what, we can't do it in an old 1980s kind of model of leadership and a way of running an organization. It needs to be much more nimble and much more flexible if we're going to deliver on those ambitions. And so that's really the driving force behind it. Every Roche affiliate worldwide is going through this, but we've been given the autonomy to be able to do it in the way that we think is right for us. So we are developing a uniquely Australian version of agile transformation for Roche, but we are obviously looking at what's happening in other parts of the Roche world and what's happening actually with other companies in Australia that are adopting this way of working.
Tell me about the mechanics of the process. So what have you gone through as an organisation and how have you engaged people? So everyone has played a role in the company, I presume?
Yes. So I think when you remember, we were talking last year, we started with some agile concepts, and I think all companies can do this. You can get the benefits of some of this way of working without changing your structure. It's often around mindsets and behaviors, which is much more around empowerment, much more creativity, not being afraid of failing, having a right to have experimentation. We also looked at radical simplification. You might remember we had a conversation about simplification of our processes and our policies. But really what we're now at the point of saying is, okay, we've gone quite a long way, but for really us to drive this and for it to really make a difference, and in particular, to get the kind of results and areas of focus that we want, we need our organizational design to be different. So in October of last year, we started prototyping a number of different concepts. And one was a concept called a chapter. And a chapter is different to a business unit, and it's very different to a department. But a chapter is the home of employees. And so you put people together who have a similar kind of role into a chapter, and they have a chapter lead, and that person is there responsible to create competency and to create a pool of resource that is then available to the organization. So we created two chapters, a chapter of medical managers and a chapter of MSLs, and we've been experimenting with that now for 8 months. So the other concept that we have been prototyping is the idea of squads, and squads are where the work gets done. And so we had two of our brand teams transform into a prototype kind of squad. They were given an agile coach, and they started to use agile methodologies, things like working in 90-day planning cycles with 3-week sprints. They've been using Trello boards and Kanbans. And trying to just play with this stuff to see what impact it would have. And as a result of that, we followed them as a total company and been giving feedback. We've decided, you know what, this is the right direction for us. And so today we introduced to the company, this is the direction the entire organization will be structured in. We've got an enabling team, which is replacing our leadership team. Everybody will be in a chapter, which is their home. The work will get done in either squads or work streams. And we've also got this concept called communities, where you've got people with a similar kind of interest that can just come together. It is fairly standard in terms of companies that adopt this way of working, but to our knowledge, I think we will be the first pharma in Australia to really be working in this way.
So what does it mean for me? Let's say I'm one of your employees. What does it mean for me from today or in the future in 3 to 6 months in terms of how I work on a day-to-day basis?
Yeah, so the fine details will be shared with our staff in August, and then we'll go through the transition, and that will take us till the end of the year. And we're really hoping that by January, the full organisation will have been onboarded and trained, and then working in this way. The biggest thing that I would say that we're finding from working this way is the speed at which you're able to work significantly increases because you're given more empowerment, and the tools help you to really focus on what's important. We're also finding the empowerment is very liberating, and we're finding that people are really beginning to question why we do stuff. And so I think certainly from the prototype squads, we found that they started to really question a lot of the stuff that we do traditionally and historically as a pharma industry when we're interacting with our customers. And the more that you adopt that kind of mindset, you realize, you know what, we need to maybe do this differently or focus on different things. For individuals, I think there are really interesting career development opportunities and also an opportunity to have a much wider impact, to work in different teams, to work in different areas of the business, because you'll no longer really be employed in a very narrow and fixed way. It's this idea that you have pools of resources that you're able to work in, and then you can swarm. I'm using a lot of nomenclature here, but swarm to the areas of greatest need.
What does it mean for the organisation externally? What does it mean for recruitment? I mean, do you think this is going to be a positive in terms of recruiting talent?
I hope it is. I mean, I would predict that many other companies are going to begin to work this way. We are certainly getting a bit of a name for ourselves, and I'm getting a lot of inquiries and questions from people who are hearing that we're beginning to work this way. And on that, I would say, look, if people are interested in learning more, then they can just contact us. One of the fantastic things about working with Agile is companies are very open, and we've been to see, ANZ and ING and Australia Post, and it's very much a community when you work this way. And we want to adopt that the same way, that if people are interested in whether or not this would work for them, then they can just contact us. Our primary goal, of course, is to look after our own people first, and of course they will be given opportunities in the new organisation to apply for the roles, and then if we need additional people, we will.
And is it a situation where your system is going to evolve sort of on a continuing basis, so it'll look different in 12 months, 24 months, 36 months? Is that how it's been designed?
Yes, it is, and that's the whole point. So you go, one of the concepts is you go when you have a minimal viable product. We don't think we have a minimal viable product, we have a viable product, but absolutely, you iterate. So we are including changes to our customer engagement models. So we're going to be changing our field-based roles, and then we'll put them out there, and then we'll get the feedback from customers, and is this working, and is this adding more value than the way that we used to do it, and what would we do that would make things even better? And then it's just this constant iteration is a core concept of this way of working.
Now, when you started your career in the industry, it would have been a very different way of working, and I presume that there are quite a few people in the company who are having that same experience as well, where the organisation is going through dramatic change. And it must mean a different emotional response for different people, depending on how they feel about the change. Is there anything surprised you about how people have experienced it or how they've engaged with the change?
It's a really good question. I mean, I think the point is you've got to give people time. And so we've only really been doing this for just over 1 year. And it's a journey, and it's a very personal journey. I mean, as you say, even for me as a leader, the kind of leader I'm required to be today is very different to the kind of leader I was expected to be 10 years ago when I first got my first GM job. And so what we're doing is we're investing a huge amount in training and coaching and support. And in fact, every team is given an agile coach, somebody who supports them, questions them, trains them, stimulates them to experiment more. So this kind of model works very much as a team and very much with a lot of backing to really make things work. It's also quite an emotional journey. I mean, people respond differently to change. But again, like all companies, we're providing emotional support to people on this journey as we go through it. But when we look at what it is we're trying to achieve, that's when people get really excited. And if I can talk to you about one of the 10-year ambitions that our company has for the pharmaceutical division, one of our 10-year ambitions is that we want to achieve 3 to 5 times more innovation at 50% of the cost to society. And that's pretty bold and it's pretty interesting. So we want to deliver 3 times or 5 times more innovation. That's going to come from driving much more productivity in our R&D. We want to double the number of new molecular entities and indications that are coming. The other innovation comes from having treatments which are more patient-friendly, that enable patients to be treated at home rather than in the hospital. Systems that really help the physicians and the healthcare system be more sustainable and productive. We want to move from having a portfolio which is based, for example, in advanced or metastatic cancer, to be going into areas where we can cure. We've got gene therapies coming. We want to start really leveraging this idea of integrated product services. So that would be a diagnostic, a pharmaceutical, and an IT solution that sits alongside it as well. So whilst we will always be, we will research and develop and create individual brands, which we will sell, a box of tablets or a vial, we're also beginning to develop integrated service offerings, which will be much more embedded into the healthcare system. And when you talk to people about that, it's a really interesting place to be. And people would say, yeah, we're not going to be able to deliver that with our old way of working. And most people want to be part of that journey because people come to work in this sector because they care about patients and want to have an impact.
So what I'm hearing is that a 1980s structure couldn't deliver a 2020 or 2030 vision. So
in our view, just because the pace at which we are wanting to move and the pace at which the environment is changing, you only have to look at COVID to look at that, the complexities of what we're having to deliver. So if we're delivering a diagnostic service, which is extremely complex, with a pharmaceutical intervention, software as a medical device, and decision support tools for the physicians to use, you're going to need a pretty sophisticated and flexible system in which to deliver that to patients in a timely manner.
Terrific. Thank you so much, Stuart. It's just very interesting. So congratulations on the change, and I look forward to hearing more about it in the future.
Thanks very much, Paul. Nice to talk to you.
Thank you.